and just one man stands up and says, no, this is the cause of the disease. If we the future behave like that, then we ain't going anywhere. He would say, no, my relationship is better than this. It's very disappointing, but we Africa must think. If you have just the idea without working on it, it won't go anywhere. It just die with you. This goes beyond Africa.
Hello guys, welcome to the Safrimental show. I'm your host, Victoria Sai. Here with me, I've got a friend. Do you mind introducing yourself?
Right, thank you very much, Victoria, for hosting me. I'm super excited. It's really outstanding to share my passion about public health. My name is Lilungwe, and I'm a third year student at the University of Lusaka studying public health. Apart from that, I'm a founder of a certain page on Facebook, Lilungwe's Epidemiology and Public Health Insights, where I share valuable insights into epidemiology and public health, aiming to create complex topics more accessible and practical to each one of us. It's a space where we can learn and grow and contribute to a future health. Well, not only that, Madam Victoria, I also got a certificate in mental health, which I was hosted by our very, very representative Madam. Thank you very much, which is Madam Victoria Mukinde, about the Boys Thrive cohort. Well, the Boys Thrive, it helped us to assist. We talked about issues such as positive masculinity. We talked about issues about mental health, most mental health, how we as the boys can manage our mental health.
That's nice. So, Abednego, what made you to get involved into public health, and what keeps you motivated?
Thank you very much. What made me get involved in public health is I grew up in a setup, or let me say a space, where health issues, preventable health issues, kept on affecting my community over and over. So seeing that, I wanted to make a difference. So public health, it's not about treatment of diseases, but it's promoting and improving health. So it was the best option for me, where I can make a difference. And what keeps me motivated is knowing that my efforts can save lives and improve the healthy outcomes of everyone. I can improve the healthy well-being of everyone and create a safer space for everyone. So that keeps me motivated and keep on moving.
Right. Okay, so what's the health issue you care about, and why is it important to you?
Right, thank you very much, Madam Victoria. That's an outstanding question. The health issue I care about, it's cholera. The issue of cholera.
Okay,
cholera is vicious and very, very dangerous. But it's preventable. Like in 2018, I remember back then in 2018, we were delayed to open schools because we had an outbreak. And not only that, in 2023 to 2024, an outbreak. We reported about 18,000 cases, and we recorded more than 600 deaths. Cholera is preventable. You get right. So we should, as a country, it's not supposed to be like that. We can prevent cholera and avoid all those deaths. You get right. So it's very, very, I found it very interesting, whereby we've got all the resources, we've got everything in this country whereby we can prevent cholera, but still it comes each and every season. So as a public health student, that's not okay. We need to work that. It shows that there's high need for prevention measures and education, as well as awareness on the matter, which is cholera.
So, Abednego, what do you think is a common myth or misunderstanding about public health?
All right, thank you very much, Madam Victoria. A common myth or misunderstanding you can see in public health is whereby people think public health is about treating diseases, yet public health is about prevention and promotion of healthier lifestyles. This is a very common myth, because I remember once my friend texted me. She's a female friend. She texted me. She wanted a photo of me in a scrub, so I sent a photo to her. But she said she posted me on her WhatsApp status, but she had to put a caption saying Dr. Abednego, which is very wrong. I'm not a doctor. By profession myself, I'm a specialist. Yeah. So that's a common myth. And another myth is about public health has got the course in public health called genetics. Genetics has got the ability to predict diseases. I'll talk of the BRCA1 and BRCA2. These are called cancer genes, whereby if you got BRCA1 or BRCA2, or if you got a cancer gene, it's going to say about in the next 50 years you won't live, you'll die. But yet you keep on living. You even reach the point where you become a centenarian. You reach 100 years, you haven't died, but genetics predict that you're going to die before you reach 50. So that's a myth or a misunderstanding. It's not. People tend to say that public health is false, but yet maybe something was lucky from the environment, which may cause the gene to showcase itself. So that's another myth in public health.
Okay, so can you tell us about a project or a campaign you've worked on to promote public health?
Right. Well, as I said earlier, that I run a page on Facebook and TikTok called Lilungwe Epidemiology and Public Health Insights, and I mostly post a lot of insights on my page. So about the campaign, I would say gender-based violence, because I really worked on the gender-based violence campaign. During the 16 days of activism fighting against gender-based violence, I kept on posting stuff, insights on Facebook on how we can fight gender-based violence. Not only that, I also attended physically the march past for gender-based violence.
So, Epidemiology, how do you balance schoolwork and other responsibility with your advocacy work?
Alright, about that, it's time management. Everything has to do with time management. How I manage my time is just creating a specific schedule. When it's time for studying, it's time for studying. When it's time, you just have to manage your time very, very well. And so about that, I know when it's time for advocacy, it's time for advocacy. When it's time for school, it's time for school. So that's how I balance up. I know what I want, and I know how I can get them. So it's about time management. I just manage my time and create a specific schedule.
Okay, so that's good. But how do you get your friends or the community involved into public health issues?
All right. Well, about my friends, all my friends know that I've been in that kind of a student whereby school comes first. So most during my discussions, I engage my friends during my discussions, because I have a lot of friends, and a lot of friends I have are students. So during discussions, I make sure that my friends get involved in healthcare stuffs. When I have an awareness program or something I'm carrying on, I would engage my friends about, no, let's do this. Because I once remember I created a group about public health, something to help my friends. And for the community part, mostly I haven't yet engaged physically on the community part, but at least I am able to share my insights through my page on Facebook and TikTok. Yeah. So that's how I do get my friends involved in the community in awareness programs.
So how do you use social media to spread awareness about public health?
Well, Madam Victoria, public health is my profession, and I'm very passionate about public health. I leverage social media for awareness programs through my page, as I once said, University of Lusaka and Public Health Insight. I mostly post tips and insights about public health almost every day. So that's how I leverage social media to promote awareness programs and promote health.
Also, Epidemiology, who's the person or someone you admire in the public health fields, and what do you like about their job?
All right. Well, I admire Dr. John Snow. He was an epidemiologist, the first man who solved, I would say the first man, but he solved cholera problem. That was in 1858 in London. His pioneering in the field of epidemiology really inspired me, and I would want also to create such safer spaces for everyone. Well, he was the man who discovered that a certain pump in London was the reason why people got sick of cholera. So that really inspires me. I'm very in love with epidemiology. I'm very passionate about epidemiology, and I would want to be an epidemiologist one day. Yeah, so that really inspires me a lot.
What do you like about the work?
Well, about the work, like it's really inspiring. Get right, whereby out of nowhere you get everyone in the community sick, and just one man stands up and says, no, this is the cause of the disease. It's very inspiring. By such discovery, it's so inspiring, get right. And I, as a passionate student, I feel like no, this is the man to follow.
It's legendary.
Yeah, very.
All right, that's awesome. But what advice would you give someone who wants to get started or wants to join in public health advocacy?
All right. First, I would say I'm not a motivation speaker, but this goes beyond Africa. It goes beyond Zambia itself. And I would like to say a quote whereby I say, even in the shadows of the unknown, a bright future awaits for those who dare to dream, who dare to stand above the storms and carry on the work out of their field to get right. So for someone who wants to start advocacy in public health, I would say the first step is always the difficult step. Immediately you just step up, everything's going to be wise. Philosophy states that an idea without weight is dead, as well as the Bible itself says that faith without action is dead. So I would say for someone who wants to take action, wants to advocate in public health, just carry on, start now. Try to join community programs. Try by all means to take the action, because if you have just the idea without working on it, it won't go anywhere. It just die with you. So faith without work is dead, and it's up to the person. It's very easy. I would give an advice. I myself, I just started like it was a dream. I just woke up. No, what can I do? How can I make it different? And I did. I was like, no. Social media, can leverage social media for the better. So I went on social media. I made a page, not on Facebook. I also went on. I made a page also on TikTok. I also got a page on Instagram, and so that's how it takes time. But trust me, if you just carry out the first step, everything is going to be wise. Young people can make a difference in public health through raising their voices in awareness programs. Not only that, the leverage of social media for advocacy. They can use social media to its advantage for advocacy. Not only that, they can also engage in community awareness programs. There are a lot of community awareness programs out there. We've got climate change programs for young people. Not only climate change programs, we've got programs to do with mass communication and all that. So yeah, not only about the mentioned organizations. We've also got, that's the reason why we've got Safrimental growth that helps young people to engage in a lot of community awareness programs. It's your platform, guys. You as the young people, this is it's your time to shine. Come on, come join us. Join all. Let's think, guys. It's our time to shine. We are the future. Some of you out there are our future ministers. You are our future presidents. We need you. Please, guys, let's think. Safrimental growth, it's an organization for everyone. You can join. We would like to have you guys. Thank you, Safrimental growth, for having me. It's really outstanding to share insights on public health, about my passion in public health. I really appreciate it. Alright, and to everyone out there, hope you join us very soon. We'll be waiting for you, and all the best in everything you do. Don't forget that the very first step you take is the hardest. Immediately you take that step, everything's going to be okay. Make sure that you stay healthy. Let's work together to create a healthier Zambia in an ultimately healthier world. We can work together. We can do this. It's our time.
Shine.
Yeah. Thank you very much, Madam Victoria, for having me. I really appreciate it.
It's been a pleasure. Thank you very much, Epidemiology. Yeah. Hello guys, this has been your host Victoria Shai. Thank you very much for watching, and remember to follow, share and like our platforms.